Hi, my name is Joie Rizzo. I'm an NPC bikini competitor. I reached out to Dr. Green at Performance Driven Therapy because I was in a lot of chronic pain since a very young age, since I was about 6 years old. I was diagnosed with scoliosis, and it is starting to affect my training for my fitness competitions, and it is also starting to affect my posing on stage.
With Joey here, first visit, she came in complaining of a lot of chronic pain. She had told me her history of scoliosis and whatnot, and a lot of her training problems and her inability to do certain exercises. So first thing we did was we did a postural check, of course, and confirmed her scoliosis. We noticed a few things as far as a lot of compression on the right side of her spine. It's hiking the hip, having her appearance of a short leg. We looked into her gait. So we take her in the hallway, we measure, see how she's gait. We noticed that one side of her body was swinging differently than the others. So we're looking at a lot of circular compression and a lot of issues going on there as well. Then we kind of looked into the squat. With her squat, you look at deviations in the foot, we look at deviations in the knee, we see how her hip hikes and what was causing a lot of these painful problems in her training in the first place. So then once we take that information, that's like kind of taking the car out for a spin, you know? So then we put her up on the table. That's like taking your car and put it on the rack, and now we're taking a look at it. So when we did all of her muscle testing, and what we saw was she was having some weaknesses over here in this right hip, correlating with some weaknesses over here in her left shoulder and her chest. So what that does is creates a need for her body to twist even more. Now this we see in normal people as well as people with scoliosis, but knowing that she's coming from a scoliotic background, it definitely tells us where we need to go with this. So second day, so after the first day, she came back in, and what did you say, about 60, 70% improvement, you were telling me? So she was saying that she's about 70% better, so we're like, yes, that was a big win, right? That was a big win.
Yes.
So that's when, like she was saying, we dig into the therapy a little bit more, really trying to unwind her a little bit and releasing some of the tissues that were bound up to slowly start to decrease, again, activating the muscles with specific manipulations and adjustments. Now we're here at the third day, and we're just gonna start, and we figured we would start to document this, right? So she's our first
gonna fix me up.
documentary. We're gonna do our best, and we're gonna try to film it all the way to see where we get with Joey and how far we can get, and address her scoliosis, and try to get her best in the gym as well as her best on the stage. So to bring us up to speed today, how are you feeling today?
I feel awesome today. I was just telling him that I did my leg workout this morning, and I actually could do a side lunge. I usually can't. It's really uncomfortable, so that's like a huge sign that I'm getting better for sure. So
today, what we're going to do is we're going to do some more functional release. We're doing some more myofascial release, some trigger point work, and we're also going to look in doing some multi-vector movements with some bands and try to get some fascial corrections going on there and some strength to go against her scoliosis pattern that we're dealing with. So thanks, guys. Hopefully this journey will be pretty cool to watch over the next several weeks.
I'm super excited.
So we're seeing that she's got a weakness still in left pec major. We also have a weakness over here in psoas. Again, we're dealing with this anterior oblique system, still having some functional issues. Good. All right, so she also got a little weakness in the oblique coming from her left to the right. This is going to be affecting, say, your competitors because of when they actually have to pose with their arms back here. This oblique has to engage, so that's going to prevent them from getting a strong twist and getting the correct angles as well. So pretty neat. All right, so let's get started. So today I think we're going to start with doing some myofascial release and some trigger point work along this anterior oblique system and into the spiral line. So the spiral line over here. So we're looking at a lot of the obliques. We're coming in from the serratus into obliques, into this TFL, down the IT band, into this peroneal, as well as the anterior tib. So we're going to start with this portion today and do a little bit into here, and then we're going to do a little bit of some work after that. So we're just doing some IASEM, otherwise known as some gua sha, commonly known as Graston, using a rock blade, the rock blade mohawk. So just trying to get some better movement out of this fascial area. We're looking for fascial adhesions so that we don't have to do all the whole line. So we're taking away these specific adhesions in this lower portion of that spiral line, and then we're going to work our way up the IT band. Ooh,
That's about right
that's
there.
a good one. So now we're hitting some trigger points along the IT band as well as into this lateralis. All the fascial connection through this whole lateral line. The way I do trigger points, I like to find them with the instrument first or with my hands. I definitely follow the rules of I'll hold the trigger point until I feel like it releases enough. There's no specific timeline. There was, some people say hold it for 10 seconds, 15 seconds, 20 seconds. I'll hold it for 3 minutes if I have to. Once we make this tissue a little hypoxic by me putting that pressure in there, it has to release. It has to take that nerve system and letting it get some better motion in that tissue. So the cool thing is it's not like we're not putting too much pressure on there. It's maybe, I don't know, maybe a couple pounds of pressure. Anywhere between 2 to 4 pounds of pressure, so not too much. And it's getting all of this reaction. You'll see that all of this stuff is completely unintentional. Like she's not controlling this at all. She doesn't even know what's happening. It's just like the body is, when we're treating it and the body stays really tight and we know they're on the right spot, and then it just starts to fight like it's having a temper tantrum. And it'll get less and less and less the longer we hold it. We've been holding this for a good solid 2 minutes now. All right, so we're probably at, oh man, hell, minute 7, minute 8, and we still got twerking going on. So her nervous system is still having a tantrum. We've kept, you know, approximately consistent pressure at the exact same area. Some of the tremors got less. Then it went into her hammies. Then she started having pelvic contractions. Now we're back into the glutes a little bit. You can see this glute max, this glute medius, having these little fasciculations almost. So we're just waiting, basically keeping pressure, and we're just waiting for it to calm down. And sometimes it takes way longer than you think. So with Joey, we're seeing a lot of trigger points that we're having to hold for a long time. So we're getting right in this teres minor. She'll get a lot of referral pain in the anterior shoulder from this teres minor. You know, a lot of times you're getting teres minor and a little bit of infraspinatus in there. But it's interesting because this same crisscross, when we add pressure to it, she starts getting unintentional fasciculations again. And so we're going to use a little bit of the vibrocussor again. And since the pain level is a little high, very super light pressure. What's the pressure on we got? What's your pain level that we got here?
Oh, probably like a 4 or 5.
Okay, cool, perfect. So we don't like going anything above a 7. We just gotta be able to breathe, relax the body. No reason to kill somebody. That was a super interesting session. That is session number 3 with Joey, and man, that was really interesting. We did a lot of work in the posterior oblique system with the spiral line. We went through, say, anterior tib, peroneal, went in through the IT band, vastus lateralis, kind of went through, you know, went through that biceps femoris, and then the coolest thing was, as we were releasing it, her nervous system was just going, you know, really fighting us. What was your, like, what did you feel about the whole thing?
It was just crazy. Like I couldn't even control what was happening. They're like, oh, you're moving. I'm like, what do you mean I'm moving? So it's pretty crazy, and I already feel looser and like I can move a little bit more. So definitely think it worked.
Cool.
For
cool.
sure.
So Next session's next week, and we'll do some more. We didn't have any time to do any type of exercise therapy because we were really so deep into the fascial methods that we were doing today. But I thought we made a real big thing, so we'll get to hear how Joey, what the result is next time, and we'll kind of go from there. Cool.